All right, good evening, everybody. My name is Monet Williams. I, along with Alicia Thompson and Latasha Garrison, are your co-chairs for today's wonderful event. On behalf of the Atlanta Suburban Alumni Chapter of Delta Sigma Theta Sorority Incorporated and the Empowerment Resource Center, we welcome you to our third session of the Ending the HIV Epidemic, Equal Access, Everyone's Voice virtual conference. We've had an absolutely amazing day. So I just want to thank everyone who has joined us throughout the day, and even those who are joining us now for our last session. We had two sessions earlier, and I wanted to highlight a few special points from those sessions. So in our housing and homelessness session, we had a great conversation about the issues with equitable housing access, as well as wraparound services for those living with HIV. We received a call to action for all D9 and community organizations to join the fight for HIV awareness and education. In our second session, our partners, Empowerment Resource Center, otherwise known as ERC, they taught us a lot, gave us a lot of great information about prevention, specifically the difference between PrEP and PEP. They also shared their suite of offerings that they provide in their office. We were also encouraged to make sure that we connect with them as a resource for all of our healthcare needs. Last but not least, we were reminded that we own our health. We need to advocate for ourselves and our relationships, and especially with our healthcare providers. So again, it's been a truly fantastic day. If you are not able to join live, please look for our replays on Facebook and YouTube.
And I just want to echo Monet's sentiments. It's been a wonderful day. Thank you to all the participants and moderators that have joined us and did such an awesome job, especially the Empowerment Resource Center. They are true professionals and they had a wealth of knowledge for all of us during the entire day. So I want to thank you for everything that you provided for us today. Our final session of the day is entitled Resilience and Impact, honoring our HIV heroes. It's an opportunity for us to honor a few women in our community who live with HIV and who are also leading the charge to make a difference in the fight to end the HIV epidemic. It is now my pleasure to introduce our moderator, Hope Ford. Hope Ford is a Morrow Award-winning and Emmy-nominated journalist for 11 Alive in Atlanta. Hope had the opportunity to join the 11 Alive team in June of 2018. Hope shoots, writes, and edits almost all her own stories on her own. A Louisiana native, Hope graduated from the University of Louisiana at Lafayette with a bachelor's in mass communications. She started in local radio before working for KLFY in her hometown of Lafayette as a reporter and anchor. She then worked as a reporter and consumer investigative journalist at WFMY in Greensboro, North Carolina, before moving up to a company to their Atlanta sister station, WXIA. In her nearly 10 years as a journalist, she's covered hurricanes, presidential candidates, large-scale protests, murder trials, the funeral of John Lewis, the trial in the death of Ahmaud Arbery, and her work has been shared by outlets including USA Today, CBS News, NBC News, Huffington Post, BuzzFeed, ESPN, MSNBC, Daily Blast Live, and Vault Studios podcasts. In her spare time, Hope advocates for mental health education and supporting pet adoption. I now introduce you, Hope Ford.
Thank you so much for that, and it's such an honor to be able to be here and to be among some truly amazing women. I've read these bios, and I'm just in awe of all of the work that all of you have done. So it is an honor to be invited here. It is an honor to be among you, and it is also an honor to introduce each one of you and talk to you as well. So thank you from the bottom of my heart. First up, I'm going to introduce Miss Eleanor Hillman. I'm going to read a little bit about her. Eleanor Hillman is a clinical research coordinator at Emory University. She works part-time as an outreach coordinator for Empowerment Resource Center, where she received the Hats Off to Women Award. Eleanor was the recipient of the Barbara Vicks Award for Woman Warrior 2021. She's worked in the HIV field for the past 16 plus years. After recovering from a 25-year drug addiction, Eleanor is most comfortable doing street outreach and realize she has a passion for helping others who are less fortunate, especially those infected or at risk for HIV. Eleanor volunteers with several community organizations, such as the Board of Directors of Integrity Transformation CDC, for the past 26 years. Eleanor was awarded the Unsung Hero Award for her commitment to the organization. She volunteers with New Jerusalem Community Ministries, where she also received the Unsung Hero Award. And her motto is, "The only time I want to look down on someone is to extend my hand to lift them up." So, Eleanor, we stand with you. We honor you for your resilience and impact. Congratulations. And I would invite you to please share your story with us.
So, hello, everyone. My name is Eleanor. And a little bit about my story is that I would say about 19 years ago, I was addicted to drugs and alcohol in the streets of what's known now as the Bluff. And I was on the streets for about 25 years. I have a passion now for women who are still on those streets. That's why I love doing street outreach. I decided one day, after seeing a young lady who I used to babysit, she was pregnant at the time, murdered in front of my door. So I just decided to go into treatment. So I went into treatment, and one day they were doing free HIV tests for a box of Church's chicken. So I says, I'm gonna go ahead and take this test. So it was my first test ever, and the test came back positive. And so I decided then that I wanted to live. I decided that drugs and alcohol was not going to be in my future. It was just going to be in my past. So I went into treatment, and I stayed for 5 years because I didn't want to leave. I really didn't want to leave treatment. And so I stayed. And when I graduated, I took off running. My feet hit the ground, and I have not stopped since. So one of the things I knew I had a passion for was to help other women that I used to be on the corners with. I used to do drugs and alcohol with, that I wanted to help them and let them know that if I can do it, you can do it. And that's why I love street outreach. I love it with a passion. That's one of the things that I love about ERC, is that they let me pursue my passion. Anytime they say we're going to do street outreach on a whole stroll, I'm off and running. I'm ready to go, because that's who I am. That's a part of me, and I always want to be that part. So I have just loved doing that, and they have allowed me to do it. Now, my journey has not been easy. And in my process of getting in treatment, I found that I had Hep C. And back then, it was the horrible treatment. It was the shots in the stomach every week for a year. And I had to do it. I mean, so I also had to know that from this day forward, that being positive changed my life and saved my life. Because if not, where would I be now? I wouldn't be clean. I just made up in my mind that I'm going to beat this thing. I'm going to live. And most of all, I'm going to help someone else live.
Thank you for that. That was beautiful. I get quite a few chills over here. I want to ask you, what's something that you wish you had access to when you were starting your journey?
Well, one of the things I wish I had access to was someone to walk me through the process, because it was hard. If you don't have determination, then that process is to me, is set up for you to fail. Because coming off the streets, you don't have picture ID, you don't have a place to lay your head. Those are the basic things, or something to eat. Those are the basic things that you're thinking about. You're not thinking about treatment. You're thinking about, what am I going to eat tonight? How am I going to pay my bills if I have any? Where am I going to lay my head that's going to be warm? And so if you don't have access to those basic needs. I was fortunate. I was in a treatment center. But if you don't have access to those basic needs, then you're just not going to do it. You're going to think about, your basic needs. I mean, and God forbid if you have children, what are your children going to eat that day? Are you going to be able to pay your bills? So one of the first things I wish that I had and others had are just the basics first.
And also I want to ask you, with all the work that you've done, what is the one area you want to see the community engage with more?
I think the community should engage more in reaching people because, I mean, yes, you can do a lot of things from a computer or you can do a lot of things from an office, but when you go out there on those streets and you touch a person and you say that I'm here, or you see my face, or you can touch me, or I can touch you and I say, okay, it's going to be all right, or I'm here to help you. Because I mean, you can touch a computer all day long, but if you don't have that just basic human touch, then nothing else matters, because there are still people who just need that touch for someone to say it's okay. Because you're not going to catch, I mean, sure, we're in a pandemic, but one thing is for sure, you're not going to catch HIV from touching a person. You're not going to catch HIV from hugging a person. You're not going to catch HIV from being around a person. So we still need that. And that's something that I think so much of us has lost.
Yeah, you're absolutely right there. Thank you so much, Miss Eleanor. I'm going to come back. We're going to come back to you in just a little bit and have some more questions for you in just a little bit. But thank you for sharing your story with us. Truly, truly appreciate that. We're gonna Miss there we are. So next up, I want to introduce Ms. Freda Jones. Let me grab this and put this up here. So Freda Jones was diagnosed with HIV in 2002. And when she was diagnosed, she knew it was time to take a stand against HIV. And Freda has been serving the community for 17 of the 18 years of being diagnosed. Freda was trained in numerous of the Debbie interventions and served as chair of the health initiative that was held in Georgia. She was featured on a faith-based HIV video, HIV/AIDS Have We Forgotten, which was nominated for a Telly Award in 2019. In 2011, Freda received an award from Sisters Organizing to Survive for the contribution that she continues to give the community. Freda is the founder of a private online HIV support network, Lotus, or Loving Ourselves Through Unity and Strength, with almost 300 women diagnosed with HIV. And Freda was recognized by the state of Georgia for her continued service to the community. So Freda, we stand with you and we honor you for your resilience and impact. I want to say congratulations, and if you can please share your story with us.
Thank you. First, I want to say thank you for having me here. So this is great. I'm really enjoying this. I was hearing an echo. Sorry about that, guys. I was hearing an echo. First, I want to start by, I always share with people that I don't have an HIV story. I have a life experience. And in my life experience, growing up in a low-income neighborhood, actually the same neighborhood Eleanor spoke about. So that tells you right there that there's something needs to be done in that neighborhood, which was a Bluff. I was born and raised there. So I think I feel that my vulnerability came from when I was a childhood. I had to experience child molestation as a child, and growing up with the low self-esteem that made me vulnerable to getting infected with HIV. I was in and out of relationships. I was settling for guys that I know did not deserve what I had to offer, as being a professional woman all my life. And so I was settling for guys that didn't deserve me. I didn't know any better. I feel like I didn't know any better. So as I got older, I decided to be in a relationship with a young man when my self-esteem was still low. I was with him almost 4 years. Did not know that this young man was diagnosed with HIV. I decided to go and he got sick. And I asked him to go and get tested for HIV. He said, no, I'm not going to get that stupid man-made test. I said, no, it's a test that everybody need if you've had unprotected sex. You know, he said, well, we in a relationship. I know we in a relationship, but you need to be tested. So it was something that I felt like God put inside me, telling me I need to go and get tested, knowing that the things that people said out there, that didn't apply to me. You know, I had never used drugs before. I was in a committed relationship. So everything that they were saying, it just did not apply to me. So I didn't go get tested for about a week, but it kept pressing and pressing and pressing. So I decided to go and get tested, and went back 2 weeks later to get my results. And they told me that everything was negative except HIV. So I went home and I told him to come over to the house, and come to find out, he already knew his status. I asked him to go and get tested. He said, I'm not going to get that stupid man-made test. I don't want to hear about it. I did not worry about it back then when they told me I was, and I'm not worrying about it now. So I was like, well, what do you mean by back then? So come to find out, I found out that he was diagnosed 9 years before him and I even met. So that's what brings me to do the work that I do for the community, because I know that I'm not the only woman that got her diagnosis from a heterosexual relationship. The majority of the women in my group, which is almost 300 ladies, 90% of those ladies got their diagnosis from heterosexual contact in relationships or even married. So that's why I do the work that I do, because I know I'm not the only one that got my diagnosis the way I got my diagnosis.
And you didn't shy away from helping the community when you yourself were learning how to live
No.
with this. And so what advice do you have for other people who find themselves in that same situation and also want to do some work and help others?
Volunteer services. I started with volunteering my services in the community, and then that's when people started seeing what I was doing, is started asking me to be on platforms like this and be open with my diagnosis, get the education that you need. And so that way you can be that support to others. I felt like I needed to be that support. I found out my diagnosis in June 2002. I was volunteering my services in October of 2002.
So quick.
Oh yeah, I felt like I needed it, because at the time I owned the hair salon, and I used to sit downtown and say, now I know I'm not the only hairstylist, professional hairstylist, not in the kitchen hairstylist. I'm a professional. I felt like I was one of the best in Atlanta, you know, so I know I'm not the only one. So I would sit down there and look at the building, but right behind McDonald's, the federal building. I said, I know it has to be some women in there that's diagnosed as well. So I just started being open with my diagnosis and being that support. And hey, it's been a blessed 19 years, blessed.
And well, I was going to ask that, do you think that volunteering so quickly after learning, do you think that kept you in a positive headspace and kept you going?
Yes, yes. It keeps me going because I see that it's needed support out here. You know, not just for the women, but for the community at large. It's definitely needed. And it helps me knowing that I help someone else to understand that they can thrive and survive with this diagnosis. It helps me knowing that I help them.
Perfect. And we're going to come back to you in just a little bit, and also ask some more questions. I have a whole bunch, and y'all are talking, and I'm writing and adding extra ones over here. So I want to make sure we can get in as many of those as possible. And if anybody else has any questions, make sure you put it in that chat below. All right, we are going to come introduce, if I can pull everything up here. Here we go. Miss Kennedy Lohman. Oh, I've lost the bio. There it is. So Kennedy Lohman, a native of Columbus, Georgia, holds a Bachelor of Science degree from Albany State University in biology and Tuskegee University in clinical laboratory science. She's the oldest child born to her mother and the fourth child born to her father. She loves her family to infinity and beyond. Her hobbies include baking, adventurous activities, reading, writing, and hanging with friends and family. She's a very loving person and always willing to give hugs and spread love wherever she goes. She's an avid volunteer and voice in the community for women living with HIV. And a few months ago, she started working as linkage coordinator for Thrive Support Services, and recently she was promoted to linkage supervisor. And under her roles at Thrive SS, she has helped Black and Brown community members living with HIV get linked to medical and dental care, support services, mental health, and food resources. So Kennedy, we stand with you and we honor you for your resilience. And in fact, I want to say congratulations and invite you to share your story.
Thank you so much for having me here today. I stand with these wonderful women before me, and it's because of them that I am able to stand here and tell my story. At the age of 29, I received a phone call that changed my life as I would know it. And the phone call informed me that you're HIV positive. And for the first 2 years, I was in a deep depression. I connected with Freda about 3 months after I would receive my diagnosis. And Freda had me out in the community to be educated and learning things. And I was in these spaces and at these events and activities, and I was seeing people that was like, I've been living with for 20 years. I've been living with HIV for 30 years. I've been living with HIV for 15 years. And it empowered me. Even going through my own status and my diagnosis, I was still out here working and volunteering with these wonderful people in the community in the Atlanta metro area. But I still had my own issues and problems to overcome. And so I only told 2 members of my family, my 2 sisters, in the beginning. And so for my first 2 years, I hid it from my family, but you could catch me out here in the Atlanta area, talking to people, volunteering, working, giving my services wherever they were needed. I am a clinical laboratory scientist. And so I worked in the hospital and I helped people on the side during my free times and at night and on the weekend, so they would feel empowered. But me, myself, I wasn't really at that point yet to feel empowered. And I got into mental health, and being in therapy, it really helped me to see that I'm going to make it. I'm going to survive and I'm going to be okay. And when I received my diagnosis 2 months before, I had just buried my sister for breast cancer. And that just further set me back. Like, what am I going to do now? But my work and my volunteering and the education that I was receiving, going to these events and these activities out in the community, they empowered me. And one day I woke up and I was like, I'm gonna live. And I'm going to help someone else live. Because being in these spaces, I didn't see many young Black women like myself. I saw a lot of the older women and a lot of the older men who had been living with HIV for 20, 30 plus years. And I knew that I was not the only young lady in Atlanta living with HIV. And I wanted to get out here to find my young sisters to let them know that you don't have to hide in the shadows, that there is life, there is fresh air. You will survive and you will thrive. And that led me to working with Thrive Support Services. I volunteered a lot on their panels and events when they needed a lady to stand. And they was like, Kennedy, we're going to bring Kennedy. Even now to this day, they are sending me out like, we got the perfect person for you. Kennedy, they need a lady to stand and speak in these spaces. And it has empowered me because of these relationships with people like Freda, my ED at Thrive Support Services, and my program manager, that they have empowered me to stand in the spaces. And as linkage coordinator, when I first started, I was meeting people and I wasn't afraid to share my story, to tell them. And a lot of them were like, you're so young. Like, wow, you're okay with telling this? And I let them know that in the beginning, I was not okay with telling this. I was not okay with myself. I had to find that inner peace myself to say that you're going to do it. You're going to overcome it. Because of childhood trauma issues myself, I had to overcome those issues first. I am grateful for my therapists that have helped lead me up to this point. I believe that without the mental health aspect, I probably would still be one of those people hiding in the shadows and in the darkness. But because of my mental health and me realizing that I really can't do this on my own, and I am grateful for my family and the love and support when I finally came out and told them that everybody was there with nothing but love and support. Hey, whatever you need, we're there. I bring my friends out to these events nowadays and they come and support and they're educated. and they take the education back to their friends and their family. Even when people are with them in negative things, like, do you think you should be near her? Is she safe to be around? And they educate them. And that's what we need. We need to bring everyone in to educate them. I am glad to be standing in this space and to be a light and to use my story. And as I tell some people, it is not for everyone. Everyone is not comfortable, and that's okay. You have to do what's best for you. For me personally, living in the darkness and the shadows was not what was best for me. And a load lifted off me when I told my story. I go into work every day and I love helping our members. I love to see that someone who was once hidden is now thriving and surviving, not necessarily telling their story, but they are more accepting of their diagnosis. And they know that, hey, life will continue. I can go on. I'm going to make it. And that makes my day, and it makes me smile and happy.
Thank you for sharing that. I want to touch on a point that you made and see if you can elaborate a little bit more on the kind of the intersection of mental health and HIV.
I feel honestly from even my story and connecting with a lot of our members, it was something that led us up to this point, as Freda stated with her childhood trauma. It was something that got us there. For me personally, in my childhood, I felt that I was not loved by the people who should have loved me. And so I was out searching for someone to love me, when instead it was me who needed to love me. And me being in therapy reminded me and showed me that you're a smart, brilliant, beautiful young lady. You have to love yourself first before someone else can love you. And a lot of these things that people are running from, if they were to address them and get the help, it would remind them that, hey, you don't have to go down this path. What someone is telling you is not your truth and your story. You know what your truth and story is. So if someone's telling you you're dumb, you're ugly, no, that's not. If you look in the mirror every day and you see, I am beautiful, I am smart, I am fine, that is what's going to empower you, so that when negativity comes to you, you know, like, hey, that doesn't work. That's not me. That's not my story. You can tell your own story. That was one of the beautiful things I learned when I first started. Don't let anyone tell your story. You tell your story. And that has empowered me when people are coming up and they're like, but you don't look like you should have it. You don't look like. Well, what does HIV look like? What does it look like I should be looking like if I had HIV? So these things have empowered me to spread the knowledge and to help everyone else.
And what, since you've been with Thrive these last few minutes, what's been your proudest moment so far?
Some of my proudest moments, it's funny that you asked, because right now I honestly can't think of any. It's to the fact of when I link someone to care and I go and they say, Kennedy, thank you so much. Like, I love this office. We give our members options. Where do you want to go? It doesn't have to be somewhere near you. It could be someone that somewhere else told you. And if I bring someone in and they say, oh my gosh, you have helped me. Thank you for listening to me. I remember when I first started, one of my first members sat on the phone for 3 hours and we were talking and we were both crying together, and I'm listening to him and I'm helping him. And he's calling me back every week, like, thank you so much for being there. I really appreciate it. You listening to me and being there helped me turn myself around. And it helped my member go back to his partner, like, this is what is really bothering me. This is what's causing our issues. It helped be that open space that he needed. And a lot of people don't realize, even with our children today, I'm a big advocate for children. They just want someone to listen. If you stop and you listen, you'll hear what your kids really need. You'll hear what the community really needs. You just have to stop and listen. Don't look and judge a book by its cover, because what you see might be the product of the trauma and the issues and abuse that they have went through. So to bring someone out of the darkness and help them turn their life around, whether it's, okay, now you're into medical care, you're taking your medicine every day, or you know that, hey, I should see a therapist, and they're getting into therapy and they're making their appointments. That makes my day. And I love when they reach back and I have a friend who could really use your services. Can you help them? Yes, please bring them all. That's what we're here for.
Perfect. Thank you so much for sharing your story. I kind of want to go to all three of you fantastic ladies now, so that we can, I have about 8 more questions than I had whenever we started. So I wanted to make sure that we can get in as many as possible. And again, if anybody else has a question, make sure you put it in that chat. Let me check the chat very quickly. Okay, no additional questions yet, but I want to kind of go back a little bit. Freda, let's talk about stigma a little bit. So there's a lot of that that continues to persist in 2021 and in different communities. So Freda, what is the biggest misconception that you still hear when you're working in the community?
One of the biggest misconceptions that I hear as working in the community, I hear from the women, they think that people think that they're being promiscuous and that they are single and just having sex with a lot of different people. And that's hard for them. It makes it hard for them to even share with their family members, because they say, oh, did you cheat on your husband? How did you get it? And sometimes it be the husband, the one that gave it to the ladies. So that I can say that is one of them. So many stigma out here when it comes down to being diagnosed with HIV, because our community is not being educated. I'm not going to say we are not out here fighting and educating them enough. It's platforms like this that we need to bring the community in. We giving them opportunities such as this platform, but it's not as many as a community as we would want. Those are the ones that we need to be trying to reach more, because I'm big on, I think if we educate the community, we can erase some of the stigma of HIV. It's stigma due to the lack of knowledge. So if you don't know it, then you don't know it. So why would that apply to you if you don't have any education about it? Why should I educate myself about HIV? I don't know nothing about that. That doesn't apply to me. So that's just one of my things. Stigma due to the lack of knowledge. So we got to educate them a little bit more, because they still think you can get it by hugging somebody. They think that we can't even have sex. Not to get on the topic of sex, but they think if you're diagnosed, you can't have babies, you shouldn't be in a relationship, you shouldn't be married, you shouldn't have a profession. They think that we should be just up on the rock somewhere. And that's so not the case.
And on that, I think we have a question here. Gonna get to that question in just a second. Another question that we had was, and anyone can answer this, the infection rate among Black women is very high. So why do you think that is? And what do you think it will take to change that statistic?
I know
Education.
a lot of women. Oh.
Now go ahead, Kennedy.
I know for a lot of women, it's low self-esteem, honestly. It's because you were abused, molested, someone constantly told you that you weren't worthy, you weren't good enough. And it's that they don't feel empowered or confident in themselves. So then even for me, I would go get tested every year. It was just something that I did for myself. But I hear women say that, their providers are saying, why do you need an HIV test? You're not in that population. And I'm constantly, what is that population? I feel like anyone having sex should get the test, because everyone's having sex. So why aren't you getting tested? Even, when we're out doing outreach and people are pulling their partners away or their spouses away, what you need that for? I don't want to have to tell you, but you should still get tested, because like Freda said earlier, it's happening in a lot of marriages where people are finding out that their spouse or their husband or their wife was positive and didn't tell them. And so now you're receiving a positive diagnosis because you didn't know. And I hate to say it that way, and I don't want anyone to think that you shouldn't trust your spouse or your partner, but you should empower to feel more and do more for yourself. Always put yourself first. And as a woman, that's the thing that we don't do. We take care of mom, dad, the kids. We do the job. We take care of the church family, the aunties, the uncles. We do not put ourselves first enough. So we have to empower these young women to always stand up for yourself. If someone's giving you pushback, I'm a big advocate for my members. If you don't like the office where you're going, if you don't like the service that you are receiving, there are a plethora of other infectious disease doctors, providers out here in Atlanta. We will find you another one. You do not have to stay somewhere where you aren't valued and treated. If you treat the whole person, you'll have a better person. And that way we can reach those who are at risk for contracting the virus before they contract the virus.
Yes.
Thank you, Kennedy. I have another question. What would be the advice you give to young Black women, as we were just kind of talking about testing? What advice would you give to young Black women who are too scared to get that test?
Offer to go with them.
Yeah.
I always let people know, even for my members, if you're scared to go to your first appointment, let me know. I will sit in that chair beside you. And I let people know who are newly diagnosed, if you have that one person that you trust, take that one person that you trust. I was glad that I had my two sisters. They started to educate themselves so they would know how to better help me navigate this new norm for me. Take someone that you trust. Or as Freda, I was a patient at the office where Freda worked. And they were like, we know the perfect person for you to talk to. And they introduced me to Freda. And that led me to being here today because she navigated me through these spaces and everything that came up. She was, hey, Kennedy, we got this going on. I think you should be there. Hey, Kennedy, I would love for you to sit here. You just need that one person who you can trust. And if it's a whole group and team and community, because once I got in the community, people were always reaching out, or me being at events like, hey, I'm glad to see you back. I'm glad you're here. And that's what we need. We need to spread love and let people know that we care. So if you give that care to someone, they'll be open to be like, okay, I guess I will go get tested. But will you go with me? Yes, absolutely.
Yes, and now we are offering the at-home test kits. You know, you can get a test kit and do it in the comfort of your home. Or like Kennedy said, you can reach out to even Empowerment Resource Center. You have Thrive SS, you have Lotus. You can reach out to us, and I'm sure we will meet you somewhere. When you're an advocate, you're an advocate. You would test somebody on the corner if you had to. If they want to get tested, you're going to test them on the corner. We don't care. I mean, because if you come to us and say, I think I need to get tested, I'm scared, what do I need to do? But like, sis, we can meet in Burger King bathroom. I don't care. If you want to get tested, you want to get tested for a reason. And I'm here for you. So if you are listening to this now, they do offer at-home test kits. If you don't want to go to an office, that's fine. We'll find it for you, or we can find you.
And there's so much that I'm learning today, like for instance, that about an at-home test, right? And so, Miss Eleanor, how do people go about finding this information when they don't know where to start looking?
Well, first, I would like to say that a lot of people think that younger people are at a high risk for HIV, but we fail to realize that older people are also at a high risk because HIV is being spread in the nursing homes, in the high rises. Now, don't think because I'm 60 or 70 that I'm not having sex. They having sex too, and they having a lot of it. And one of the things that older people, the reason they don't get tested is because of the way they were brought up. I don't use condoms. I'm not going to use condoms. I'm not going to start using condoms. No, HIV testing is not for me. That's what them young folks do. But any given high rise you go into, they are going from apartment to apartment, having sex. They are, it's just something that they do. So don't think now time that an 80-year-old man ain't having sex, because they are, and they're having a lot of it. And so one of the things that I would say places to go get tested is just about every street corner, there used to be someone out testing. Now, people don't want to go into the health clinics, or like Freda said, if you want to get tested, go in the bathroom or wherever you want to go in. But so many people are afraid to let someone see them getting tested. Why are you getting tested? Or you done did something, or are you promiscuous? The reason for getting tested. But there's one thing that I like about Holstro, and that is these girls want to get tested. So you got to be on these streets to get them tested. They want to get tested because, number one, their status shows that they show their status letter to their Johns or whoever they get in a car with. We were out on a street corner on a host stroll one day, and a young lady, she was a sex worker, she got tested, and then she got in a car. The car went around the corner and came back, and he got tested, and then they went and did their business. So it's more about if you want to get tested or the urgency of getting tested, or we have to get out there so that people can get tested. And I applaud Freda. I know her very well. I mean, she's one in a million. She'll test you anywhere. She'll slide up under a car and test you if you want to get tested. But the main thing is getting out there on the streets, because they're not going to come to you. A lot of these people don't leave their neighborhoods. I know a girl, she's been in her neighborhood for about 40 years, has never left those four corners. So what do you have to do? You have to go to those corners. And that's just the bottom line. We have to get out of these offices. We have to get out of our safe, comfortable place and test. Because it's not going to come to you. You have to go to it.
And what about, about that? What about people who have recently been diagnosed? Where can they get those access to some resources?
Well, one of the things that you can do is there are places like the IDP clinic. They have wraparound services for you. There are places like Atlanta Harm Reduction. They have wraparound services. There's a place called AHART, Atlanta Harm Reduction. If you're recently diagnosed, I know for a fact, if you're living on the street, Atlanta Harm Reduction will put you up in a hotel and get you off the streets. They'll give you something to eat, because like I said, without those basic needs, your mind is not going to be on getting in treatment. So you have to find places that have wraparound services. Like one of the things I love about ERC is that I remember this young guy, he came in and he tested positive, and he was just so hysterical. And they came and got me, and we sat in that room for about an hour. And guess what we did? We hugged and we cried together. We hugged and we cried, we wiped our eyes, we cried some more. We wiped our eyes, look, we wiped our running nose, and we cried some more. So you have to connect people with people who understand, with people who can just say it's gonna be all right and walk you through the process. Because if you don't have someone to walk you through the process, guess what? You're gonna get lost in the system.
Yeah.
And for people who have been recently diagnosed, how do you go? There has to be some fear there whenever you first get that diagnosis. So how do you go about, starting to have that conversation, and where do you go whenever you just don't know what to do anymore at that point?
Well, one of the things you do is it's about trust. Once you put that trust, or that person trusts you, then they trust the process. They trust that you're going to see them through it. You can't take a person and walk them in the door and say, okay, you're on your own now. You have to walk them through the process, and then also let people know when you're walking them through the process that they have someone here to stand up for them, or they have someone standing here with them to hold their hand and say, we're going to go through this together. Because it is a scary feeling. It's a feeling that, am I alone? When you're not alone. And once people realize that they're not alone and they have someone that they can say, well, this is someone who cared enough about me to hold my hand and walk me through the process. There's a young lady that I met her, she had been sleeping under a bridge for 8 years down by the stadium. And we tested her, and she tested positive. And I walked her through the process. I saw her the other day, and I didn't know who it was. They just ran up to me, and I was like, who is this person hugging on me? And she ran up to me, and we walked her all the way through the process up to the point of her getting an apartment. And she not only has an apartment, she has a car, she has a job, and then come to find out, she has a legal job. And I mean, she's a paralegal. So, people are people. I don't care where they come from, what they do. They're just people. They just want someone to care about them and hold their hand. And I was so proud of her. I mean, we just stood there for about 10 minutes, just embracing each other because of the fact that, and even with masks on, she knew who I was. And me walking her through the process of getting in treatment, and this was when Fulton County was still across the street from Grady. I mean, I remember the countless hours we took time to go pick her up. Sometimes we couldn't find her, but if I know your street name, then I'm gonna find you. And just sitting there with it, it would take sometimes 2 days, 3 days of 8 hours a day. I mean, I thought I was clocking in and out of Fulton County at one time. I thought it was time for me to go to lunch, but it was important to me to hold her hand and walk her through this process so that maybe one day she'll be able to walk somebody else through that process.
Yeah. And that was another question I want to ask of everyone. What is tell me the importance of people seeing success stories and seeing people moving on with their lives and not being hindered by a diagnosis, but going through it and getting resources, getting help. Talk about the importance of people seeing that represented instead of sometimes the things that we do see, the negative images that we see in the media.
I think it's good for them to see a success story because it could help their family member. Once they see us and say, wow, they thriving, they surviving. Let me have my sister, my mom, my brother, or someone call them and let them know that they are doing great things. Mm-hmm. I have to let the people that come into my office, first I ask them, what are you feeling? And so once I get through all of what you're feeling, what is it that I can do for you? And I've had people to come into my office that think that their career is over. Mm-hmm. Now they are gospel singers, models. We have I'm not gonna say that, then y'all know who she is. But we have some very professional people out here that say, you know what, my life can still continue. Mm-hmm. Thank you for that. So we need the world to see that there is life after your diagnosis. Don't go up under that rock that they think we should be up under. Continue to live, continue to be the best doctor, lawyer, school teacher, whatever it is that you want to be, you can still be that. Mm-hmm. And I make sure they know that before they leave out of my office.
I know for me personally, it's sometimes people don't see that we might clock out at work, but our work continues after hours. It continues in the evening when someone reaches out to you like, I don't know what I'm doing. I'm about to kill myself. What is going on? I hate my life. That work continues for us in the community. It doesn't stop when we clock out at that building. And sometimes it's tiring and it's hard for us. And I can see how social workers feel because you just never can turn it off. Like Freda said, once you're an advocate, you're an advocate. So no matter what space you're in, you're always rooting to empower and push someone. And to see that success story, you're like, okay, it makes sense. What I'm doing, it's working, it's counting. Mm-hmm. You might have a few that you lose by the wayside or those who just aren't ready because guess what? Someone might receive their diagnosis and they say, hey, I take my medicine every day, but I don't want to talk to y'all. No, I don't want your support. I don't want you calling me. But that's their part and they're not ready yet. But you still lend them that support and you still let them know that, hey, you're not ready right now. Guess what? If you call me in 2 weeks, I'm here for you. If you call me 2 hours later, I'm going to be here for you.
Yeah.
We have a R3 process at Thrive when we meet with our members where we connect with you that first day. 7 days later, we're going to reach back out to you. Hey, did you make that appointment? How's it going? Did you get that medication? Do you need help? Do you like the provider? 30 days later, we're going to reach back out to you again. 60 days later, we're going to reach back out to you again. How is going? Hey, love, you good, boo? You all right? Do you need anything else? What's been going on in your life? 90 days later, we're going to reach back out to you. 180 days later, we're going to reach back out to you. 365 days later, how has your life changed within this year since you have became a part of our family? Because once we bring you in, you're a family. And for me personally, I let certain people know that I connect with, like, okay, you might need a little extra special Kennedy love and care.
Mhm.
Yeah.
And guess what? I'm gonna call you when you don't think about it. I'm gonna send you a message for those that I know that say, I don't like taking that medicine. I'm tired of that. I don't want to take it. Guess what, babe? You said you take your medicine at dinner time. It's time for you to take that magical pill. Did you take that
Yes.
magical pill? Let me know. I'm here for you. It's the support and love to see that, guess what? Someone is now like, I took my medicine for 7 days straight, Kennedy.
Right?
Oh my gosh, I am so proud of you. It's a
Yeah.
love and support. And I let them know that for me, for those that need that extra love and care, you can now consider me your mama bear. I do not care if I am 34. I don't care if you're 55. Guess what? I'm gonna call you like, hey, love. Today, I know you was having a hard time. What do you need from me? How can I help you? It's that love and support that
Yeah.
keeps us going. Or to hear someone
Yes.
call me back. I didn't know when I first started at Thrive, one of our staff meetings, and they were like, Kennedy, they love you. Like a lot of people are giving us good feedback. They love talking to you. They say you listen to them, you're caring us. And I'm like, me? Like people are talking about me. And it's like, okay, y'all trying to make me cry. But it's that love and support that I felt I needed and I didn't always have when I needed it that makes me in turn give it to those who I feel might need that love and support, where they don't have that family or they don't have that support system. I'm here for you. So if you need to call Kennedy, text Kennedy, Facebook, DM me, I am here for you.
And we have about 4 minutes left, and I want to make sure that I hear from each of you about what you do to make sure that you're kind of refilling your own cup and putting yourself as a priority when you need to make sure that you can continue to do that work. So, Miss Eleanor, can we start with you?
Sure. So what fills my cup is knowing that I've done something positive. And I getting up every day knowing that I've made someone's life better, that's what keeps me going. Because when I was doing drugs and alcohol, I got up every day like clockwork to make sure that I got my drug. So guess what? Getting up like clockwork and making sure that I made someone's life better, or that I tested someone and or helped someone get in care, then that fills my cup. It overflows my cup to know that, I mean, that's what I thrive on. That's what gives me energy. And like on Sundays when I go to church, I always have a bag full of condoms. You know why? Because the ladies on the street wait on me to pull in that church parking lot. And I say, hey, wait, stop it, drop it, break it down. Let's get some of these. And they love that. They wait on me for that. So that gives me energy. That fills me up. And that's what I do. That's what makes me feel like I've done something productive on this day. Because it's not about me. It's about us. Because I am I am a person that used to be on this street corner. So guess what? I'm still on that street corner because I'm on that street corner passing out condoms.
And Ms. Freda, what about you? What do you do to make sure you're prioritizing yourself as well?
The things that I do to prioritize myself is I love music. I love music. When I get in my mood and I know I need some therapy, I use my music for therapy. I sit out on my deck, light me a candle. I have my granny juice cup and I mind my business and just listen to me some music. And I enjoy my day because I know that's important as well. You can't take care of someone if you're not taking care of yourself. So I have to make sure I take care of myself so that way I can take care of others. Because if I'm broke, they're going to be broken as well.
Like how you slid that comment in there about that cup. We all caught that. All right, Miss Kennedy. What about you, Miss Kennedy? What do you do to make sure that you're prioritizing yourself?
I love to hang out with family and friends, not necessarily just the family that I was born into, but my community family, whether it's we're getting together for lunch. And as Freda said, you know, those special granny cups, I love it. And if it is a really difficult time, I cut off. Hey, I'm cutting my phone off, no social media. I just need me time to rest and relax and rejuvenate, refresh my mind. But I am really always a person on the go. So you're probably going to catch me out somewhere, trying a new restaurant, trying a new adventure, hanging with family and friends. It's me. I like to be on the go.
All right, thank you all so much. It has been a pleasure to talk to all of you. Like I said, I'm honored to be among all of you. I'm honored to talk to all of you. And thank you so much for everything that you do every single day, every single hour, every single minute, from handing out the condoms at the church, everything that you do. Thank you so very much. And thank you all for also having me. And right now we have about 5 minutes left, so I want to make sure that I pass it up everything on to Ms. Sabrina Clark, the president of the Atlanta Suburban Chapter of Delta Sigma Theta Sorority. So thank you all so much, and I will hand everything over to Ms. Sabrina.
Thank you so much, Ms. Ford. Man, what a powerful and this powerful testimonies tonight that we heard. I think we hear it all the time. Know your status, know your results. And there's so many times that there's so many of us that really can't say, do you know your status? They really don't know, because there's that fear of even finding out, or there's that fear of not wanting to ask their regular doctor, to test them for it, for HIV. I think there's so many men and women that probably mistakenly assume that, oh, that could never happen to me. And maybe that's why they don't know their status. Yeah. I think, just from the testimonies like the ones we heard tonight, we all need to help to erase the stigma and always be thinking prevention and protection. HIV really doesn't have a certain look. And I think there's an assumption that someone's going to know just by being able to look at me. No one knows. No one knows that you have that fear. No one knows that you had unprotected sex. No one knows that you may have been abused or molested. But I think the one thing that, we would all know ourselves is if you have that fear, if you have that fear either not knowing, if you have that fear of, are you questioning if something may or may not be going on outside of your household with your spouse or significant other, only you know that. We don't know that. And so, feel empowered to protect yourself and to, always, know your status. I think a couple of things that I did here tonight were to empower yourself, protect yourself, know your status, take care of yourself, and get your granny cup. I heard that granny cup a couple of times. Black women are being diagnosed with HIV at a higher rate than any other group. And to hear that should really be enough to scare you into going to get tested. If you don't want to get tested at your regular doctor out of embarrassment or out of fear that you may get a negative result or positive result, and you don't want your doctor to know that about you, guess what? There's other options out there for being able to get tested without having to use your regular doctor. Knowledge is power. And I think women typically want to know everything. You know what? Let's apply that same principle to knowing about our health. As Hope said earlier, I am Sabrina Clark. I'm chapter president of the Atlanta Suburban Alumni Chapter. And I want to say a big thank you to all of our panelists for sharing their stories this evening. Definitely thank you to our moderator, Hope Ford, and kudos to our hardworking International Awareness Committee. Job well done. Today has been a full day for the committee, as this is the third forum of the day. They started at 10 o'clock this morning. First forum was at 10, second one at 12, and here we are again, starting the third one at 7:30. Thank you to the committee for keeping our chapter and the communities that we served informed. In closing, I will say season's greetings to everyone. Be safe, protect yourself, and know your status. And with that, I will turn it back over to our subcommittee lead. I'm assuming maybe Sarah Williams or Sarah Thompson.
Last word, President Clark, just to echo her sentiments. Thank you so much, everyone, for joining. We really appreciate the engagement all day from each of our panelists.
Thank you for having me.
Thank you.
Have a good night, everybody.
Good night.
Thank you.
Night, thank you.